Hello everyone, my name is Dane Maurer-Vakil. I'm currently a Health Services Research Master's student at the Institute of Health Policy Management and Evaluation at the University of Toronto. Thanks for your interest in my poster. In this video, I'll provide a brief overview of my work-in-progress thesis research, currently entitled Approaches to Integrate Mental Health Services in Primary Care, a Scoping Review Protocol of Barriers and Enablers to Implementation. This work is funded by the University of Toronto and the Canadian Institutes for Health Research. Before I begin, I'd like to acknowledge my thesis committee, made up of Drs. David Rudler, Sarah Allen, and Nadia Sunderji. Okay, let's jump in. In Canada, 1 in 5 people will experience a mental health problem annually. Furthermore, by the time Canadians reach the age of 40, half will have or have had a mental illness diagnosis. The economic burden of mental illness in Canada is estimated at $51 billion per year, and this includes healthcare costs, lost productivity, and reductions in health-related quality of life. Despite the growing prevalence of mental illness, the integration of mental health services in primary care has been a persistent challenge in Canada. Primary care is viewed as a crucial point for diagnosing and treating mental illness, and is often the first point of contact for individuals within the health system. Yet primary care providers are often ill-equipped to manage mental health conditions, and access to mental health specialists are fraught with access barriers due to cost and wait times. The benefits of mental health services in primary care includes reduction of stigma, improved treatments of comorbidities, and enhanced access to care. To address these health system issues, investments have been made in models of collaborative care in Canada that usually provide access to interdisciplinary teams, including some form of mental health services. In Canada, collaborative care is defined as a patient-centered process in which 2 or more professions interact to share knowledge, expertise, and decision-making in the interest of improved patient care. In primary care, where mental disorders are commonly treated, more than 80 randomized control trials have demonstrated that collaborative care, although not specific to mental health, is more effective than usual care in relation to cost effectiveness, clinical outcomes, patient and provider experience, and quality of care. So given this high-quality body of evidence, it's critical to study how collaborative care can be implemented on a wide scale. While the implementation of collaborative care does vary considerably across primary care settings in Canada, less is known about how it can most effectively be implemented. So this is the knowledge gap that my study aims to address. My research question is, what are the system-level barriers and enablers to implementing collaborative care models to integrate mental health services in primary care? This project will follow guidelines for scoping reviews, including Arksy and O'Malley's methodological framework, the Joanna Briggs Institute's Manual for Evidence Synthesis, and PRISMA standards. To date, Medline, Embase, and PsycInfo databases have been searched, which resulted in 3,243 distinct articles. With the assistance of a second reviewer, these articles were screened at the title and abstract stage, with 262 articles having moved to full-text screening. Subsequently, 115 articles were included and thus selected for data extraction, or charting. All articles were written in English and published after 1990. I've included a table on my poster that briefly outlines the key aspects of my inclusion and exclusion criteria. The Consolidated Framework for Implementation Research, or the CFIR, will be used to inform the analysis. The CFIR is a commonly used implementation science framework to facilitate the design, evaluation, and implementation of healthcare interventions. This framework is customizable across diverse settings through its provision of a variety of constructs and subconstructs that are arranged across 5 domains. These domains are intervention characteristics, outer setting, inner setting, characteristics of individuals, and process. The implementation factors of included articles will be systematically coded according to the CFIR elements. I've included an image on my poster that displays the CFIR categories. This project's findings will fill a knowledge gap regarding the barriers and enablers to successful implementation of collaborative care models that integrate mental health services in primary care. It will also serve as a foundation for future research. Research results may inform policies to support the implementation of such collaborative care models. And this work has the potential to contribute to mental health system reform in general and improve population mental health. Thanks again for your interest in my poster. Please feel free to reach out through email for more information on this project as it evolves. I've included my email address on the bottom right hand side of the poster, so feel free to reach out. Thanks again, and bye for now.